Hi, Kevin Henry, the Group Editorial Director for Advanstar and Modern Hygienist, and I'm on a Google Hangout today with America's dental hygienist, Anastasia Turchetta. Hey, Anastasia.
Hey Kevin, soaking up some vitamin D. How about
Well,
you?
you know what? I decided if we're going to talk about sunscreen and protecting ourselves from the sun's rays, what better way than for both of us to be outside to do this, right?
I agree. No better way. We should do it more often.
Hey, I'm all about it. So I guess the question, whenever you first talked to me about that we should do something on this topic, my first question back to you was, are the lips part of the dental team's turf? And I wanted to get your take on that. Where does dentistry stop as far as this is what they should be concerned about in the practice?
Yeah, that's a great question. I think we're so honed in sometimes on what's going on intraorally that especially as summer kicks off, we've got to really look extraorally, focusing on the lips more often, especially for this hangout. But I mean, it doesn't stop there. It's head and neck. So that includes your ears, your nose, other people, their scalp, their neck. So I mean, it just doesn't stop there, but particularly the lips. I'm surprised at the stats that I found, and it's just educating the patient. And you know what? That starts with us first.
Well, as I told you before we came on, I remember some of the worst sunburns that I ever saw on my dad were actually on his lips. And, it was just something that he would keep getting sunburned, time after time during the summer. And that's something that we're obviously wanting to stop people from having happen, right?
Absolutely. In fact, one of the statistics that I found that the lower lip especially is 12 times more likely to be affected. Get a load of this, especially in fair-skinned men over the age of 50. Your dad's right in there.
That's my dad. Absolutely.
Mhm.
Nailed it.
Yeah, so this might be something we can, share with our patients that fall into that category, and educate them on SPF because especially men, I'm not saying to go out and get glossed, but I mean, I'm saying to like invest in lip balm or even some lotions or something just to slap it on there.
And what should they be looking for whenever they're going out or they're talking to their patients about how to protect their lips?
One of the things I think we can go over are tips for kissable lips. So here's some things to think about when you're looking for a product. And I think especially for men because they're not going to go out and get gloss, obviously, but lip balm or even some lotions, you want to look at the SPF, which is sun protection factor. Now, I'm looking at chapstick and Burt's Bees and all of these. I mean, there are hundreds of brands out there, but many of them start with SPF 4 to 6, when in fact, the Skin Cancer Foundation recommends an SPF, get this, at least 30, 30. Many, I mean, there are so many of them that don't even meet that criteria. So that's the first thing to look for. Also, you need to know if you're at risk. So I think we need to go over that with our patients. And here's a couple of risk factors. One, your dad fell right into the category is age. Men, especially light-skinned, over the age of 50, a family history of skin cancer, anybody who is, who burns easily. And if you think about your lips when you, I don't know, people tend to lick their lips a lot. And what we're doing is introducing the bacteria that it digests the food. Think about it, that we're eating. So that bacteria is on your lips. So what's it going to do? It's going to chap your lips. So that's why people get drier lips. And then, of course, it's more susceptible to burning. And, it's just not healthy. It doesn't make them kissable for sure. So the one thing, you also want to look at are blue eyes and green eyes. I didn't know that. Who thinks about that, for at risk for lip cancer, if you will. So, I mean, there's different things. And, of course, tanning beds. We can't leave that out either. But looking for SPF and talking about that with our patients, I think, is very important. So keep in mind it's the SPF of 30.
As many Google Hangouts as you and I do, and gosh, on e-cigarettes, marijuana usage, sunscreen, I mean, we've run the gamut here, but
We do.
everything we talk about, it really boils down to that whole education and really talking to your patients and not being afraid to bring it up, right?
Absolutely. And when you look at it, I mean, I didn't know about the men and the lower lip being 12 times more likely, when in fact, if you think about it, the other statistic was how let me just check it here, 60% of females have it in our upper lip, which I find fascinating because if you notice, no factor, it's strictly just my opinion, when men talk, we see more of their lower lip, most men, and when women talk, usually we see more of our upper teeth. I mean, when men talk, it's more of their lower teeth. So I don't know if that's got anything to do with it, but I find it interesting that the lips are different per gender.
It is, and again, it's just something that dental professionals need to kind of tuck in the back of their mind, especially this time of year. All around the country, and certainly all around the year in places like Southern California and South Florida and places like that.
Absolutely. And you know what? If you were thinking about marketing, why don't you get a chapstick that's got SPF 30 and put your practice name on it? I mean, now that would really rock.
There you go. Boom. See? Anastasia comes through with the marketing ideas even. I like it. So.
Always thinking about that. And the other thing, too, if you wanted to look for a guide and see if somebody offers, goodguide.com has all kinds of brands they offer. You can check it out: lip balm, lipstick, lip gloss, SPFs, and whether or not they're tested on animals. Great site to check out.
And it's goodguide.com, right?
Yes.
Cool. And any other sites out there that you kind of come across would want people to look at maybe?
The other one would be Consumer Reports. They actually did one on SPF lotions, and they did one on 20 lotions, and only 2 of them came out that actually had the SPF in them. So you always want to go at least 30, no higher than 50.
Great advice as always. Anastasia, thanks for the time, and hey, let's go out and get some sun and enjoy the summer.
Great. Thanks for having me, Kevin.
All righty.